Welcome to the Jefferson County Public Schools Bloodborne Pathogen Training Module. This program will prepare and train employees for potential exposures to bloodborne pathogens and other infectious material. The primary purpose is to effectively protect all employees in JCPS facilities that are exposed to bloodborne pathogens and/or other infectious materials. JCPS is required to be in compliance with the OSHA Bloodborne Pathogen Regulatory Standard. A written bloodborne pathogen program, or BBP, is required by OSHA. This applies to all JCPS employees who are exposed or will have the potential to be exposed to bloodborne pathogens and/or other infectious materials. All JCPS employees working in contaminated or possibly contaminated areas must adhere to the JCPS BBP. Why should JCPS employees be concerned with bloodborne pathogens? OSHA estimates 5.6 million workers in healthcare and other facilities are at risk of exposure to bloodborne pathogens such as HIV, hepatitis B, and hepatitis C. HIV, or human immunodeficiency virus, is the virus that leads to AIDS. HIV depletes the immune system, reducing the body's capacity to fight off infection. Overall, HIV does not survive well outside the body. The symptoms associated with HIV include flu-like illness, weakness, diarrhea, and weight loss. According to the Centers for Disease Control, there are approximately 1.2 million people currently living with HIV in the U.S. About 13% do not know they are infected. Hepatitis B virus is commonly referred to as HBV. There are approximately 1 to 1.25 million people chronically infected. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, and vomiting. Hepatitis B may eventually lead to liver disease, liver cancer, and possibly even death. A vaccine has been available for hepatitis B since 1982. Hepatitis B can survive for at least 1 week in dried blood. Hepatitis C virus is commonly referred to as HCV and is the most common chronic bloodborne infection in the United States. Symptoms of hepatitis C virus can include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, and vomiting. Hepatitis C may eventually lead to chronic liver disease and even death. There are approximately 4 million people currently infected in the United States. Only 25% are diagnosed with having hepatitis C, and there is no effective vaccine that currently exists for hepatitis C. Potentially infectious materials includes, but is not limited to, blood, saliva, vomit, urine, semen, vaginal secretions, skin, tissue, cell cultures, and other body fluids. There are several modes of transmission and ways blood and other potentially infectious disease can enter the body. They can enter the body through breaks in the skin, mucous membranes, sexual contact, acne, open sores, contaminated sharps or needles. JCPS has an exposure control plan located in the BBP. The exposure control plan is a plan of action for any exposure that occurs where blood or other potentially infectious material is involved. This plan consists of exposure determination, methods of compliance, hepatitis B vaccine, hazard communication, record keeping. The exposure determines which groups of employees have the greatest exposure to blood or other potentially infectious material. All job classifications in which all employees in those jobs have occupational exposure include, but are not limited to, nurses, designated first aid, CPR responders, and exceptional child education staff, job classifications in which some employees have occupational exposure, childcare teacher and assistants, security staff, early childhood teachers and assistants, physical and occupational therapists, bus drivers, early childhood education instructors and aides, plant operators and custodians, staff teachers and athletic staff. All tasks and procedures in which occupational exposure occurs and that are performed by employees includes treating wounds, cleaning up blood, performing first aid, giving injections. Universal precautions shall be utilized for compliance purposes to prevent contact with blood and other infectious materials. Assume that all blood is positive for HIV, HBV, and HCV. Assume that all other human fluids and tissues are also positive. Treat all fluids as potentially infectious. Assume that all individuals are carrying these disease organisms. Avoid skin contact with blood and other potentially infectious materials. Avoid eye, nose, and mouth contact with blood and other potentially infectious materials. Avoid punctures and sticks with contaminated sharp objects. Clean up blood immediately to prevent further exposure. Remove one glove, turning it inside out, hold it in your gloved hand, and roll both gloves together so that they are inside out. Dispose of gloves. Wet your hands with clean, running water and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water. Dry your hands using a clean towel or let them air dry. Engineering controls protect workers by removing hazardous conditions or by placing a barrier between the worker and the hazard. The purpose of engineering controls is to eliminate or minimize employee exposure. Some ways to eliminate or minimize exposure to blood or potentially infectious material include having readily accessible hand washing facilities, managing contaminated sharps, keeping food and drink out of the work area, and blood handling procedures. Personal protective equipment, or PPE, used to protect against blood or other potentially infectious material include gloves, gowns, laboratory coats, face shields, eye protection, and/or masks. PPE will be provided at no cost to the employee. It would be of the appropriate size and made readily accessible to all JCPS personnel. PPE will be cleaned, laundered, and disposed of as necessary. PPE will also be replaced as needed to maintain its effectiveness, and it shall be removed prior to leaving the work area. Housekeeping is an effective tool in eliminating and reducing exposure to blood and other potentially infectious material. All work locations and departments will be kept in a clean and sanitary condition. Contaminated work surfaces and equipment shall be decontaminated after any spill of blood or other potentially infectious materials. Contaminated laundry shall be placed and transported in bags or other labeled containers using universal precautions. Please ensure that proper disposal methods are followed when cleaning up blood or other infectious material. Decontaminate all materials, including gloves, towels, specimens of blood, or other potentially infectious materials. Place in a closed container or bag to prevent leakage. The primary container or bag will then be placed in a secondary container or bag to prevent leakage during handling and disposal, and place immediately in the exterior dumpster. Specimens and containers that remain within the JCPS facility will not require labeling or color coding if universal precautions are utilized. Contaminated needles shall not be bent or recapped. Contaminated needles must be placed in sharp containers immediately after use that are closable, puncture resistant, leak proof, labeled and color coded. The hepatitis B vaccination will be made available to all employees who have occupational exposure to blood or other potential infectious material. The hepatitis B vaccination shall be provided at no cost to the employees, conducted by a physician or licensed healthcare official, provided within 10 working days of initial hire. Employees may decline the hepatitis B vaccination by signing a declination form. Every employee exposed to blood and/or potential infectious material shall be trained on bloodborne pathogens. Training shall be provided to employees at the time of initial hire and annually thereafter. Employee medical records shall be maintained for duration of employment plus 30 years. Employee training records shall be maintained for 3 years from the date of training. Exposure incidents include any applicable exposure to blood or other potentially infectious material. In the event of an exposure incident, report all accidents involving blood or bodily fluids. Fill out an exposure incident form and a patient consent and physician treatment form if applicable. Post-exposure medical evaluations are offered to affected employees. JCPS has specific procedures for reporting exposure incidents. JCPS employees will report the date, time, and type route of exposure to the supervisor, principal, building manager. The supervisor, principal, building manager shall initiate an exposure incident form and send to the Safety Environmental Services Department. The supervisor, principal, building manager shall identify and obtain consent, if able, for testing of the source individual's blood. The supervisor, principal, building manager shall immediately report the incident to Workmen's Compensation Unit. The supervisor, principal, building manager shall initiate the employee's consent form and be assured he or she takes the form to the designated medical healthcare facility. Adhere to follow-up treatment regimen and/or testing as prescribed by the physician. The post-exposure medical evaluation is a confidential medical evaluation and follow-up for employees. The post-exposure medical evaluation will include routes of exposure and circumstances, documentation and identity of the exposed individual, signing a consent form to have blood drawn for testing. If consent is not obtained, JCPS shall establish that legally required consent cannot be obtained. Exposed employees will be provided the results. Any reported illnesses will be evaluated. Often, there is not 100% compliance with the OSHA bloodborne pathogen regulation. Lack of compliance is associated with the following: no training, not using PPE, not washing hands, busy, hectic, rushing, decreased awareness of hazards. Employees think, it won't happen to me. It's important that you follow the bloodborne pathogen program. Safety matters. For more information, please contact the JCPS Safety and Environmental Office.